This is Doc W, Global Medical Facts and Healthy Living channel. Today I'm talking about episode 3 of my presentation. In my third episode on this channel, I'll be talking about the hidden side effects of Ozempic nobody talks about. So the hidden side effects of Ozempic nobody talks about is my third episode, and in this series I'll be focusing on this drug Ozempic side effects. So Ozempic is famous for weight loss in this time and era that we are in, but very few people are talking about the side effects. So the hype about this Ozempic is making us have the desire to talk about it more. And some of the side effects that are coming with this Ozempic use are as follows. I'll talk about nausea. Nausea is number 1 on the list of the side effects about this drug. Number 2 is the stomach pain. Number 3, non-side effect, is the muscle loss. Number 4, non-side effects is the psychological changes. Why am I talking about this? The side effects, I'll talk about them because some of the risks that are much more serious today are these things about fear and fear mongering. So here I'm not talking about that. I want you to understand those side effects. I don't want to spread fear, because every powerful medication has two sides, and that's why it's good that when you're using medication you talk about its side effects. Let's talk about the one social media avoids, the side effects. So in my first section, why side effects happen is because Ozempic mimics the GLP-1 hormone released by our bodies. But GLP-1 receptors exist in the following organs. The GLP-1 receptor exists, number 1, in the pancreas. The GLP-1 receptors exist in number 2, the stomach. The GLP-1 receptors exist in the organ number 3, the brain. The GLP-1 receptors are also seen or are found in the intestines or intestines, depending on how you are going to pronounce it. And then the GLP-1 receptors are also found in the gallbladder. So when all those organs have those receptors, you expect there to be a process going on when you are taking Ozempic. So when you activate this pathway strongly, you affect multiple systems. So that's what happens with Ozempic. Those pathways will be activated very strongly, and then there will be multiple systems that will be affected. Some side effects are not random, they are physiological. So the body will actually respond in a certain manner. In my section 2 on these common side effects, I want to focus on this effect. Those side effects affect many patients early on. So some of these that affect many patients early on are: number 1 side effect will be nausea, and number 2 side effect will be vomiting. Number 3 side effect will be diarrhea. Number 4 side effect on converse will be constipation. And number 5 side effect will be bloating. because the constipation and bloating, we know that, and the acid reflux will be another side effect, because the drug is known to slow the process of gastric emptying. So in return, we expect there to be bloating, there to be acid reflux, there to be constipation, because the motility of the gut is so slowed down, and that is bound to arise. So why? Because Ozempic slows the gastric emptying that is supposed to be taking place, and food stays in the stomach for so long, and for some patients that settles, or this settles after weeks. So some of the early symptoms is because the system is not used to such slowness of the gastric movement. So, but for others, it doesn't actually cause such symptoms. Important is that dose escalation must be gradual. So starting someone on small dose before you move to a stronger dose may help reduce such side effects. In my third section, let me talk about muscle loss. That's another side effect. And with muscle loss, here's something that is rarely discussed. So weight loss is not only fat, and therefore muscle loss is also actually exhibited when weight loss is happening. So you'll experience muscle loss. So without the following: adequate training, without resistance training, you will lose your lean muscle weight, and that is bound to happen if you're just sedentary and you're using Ozempic. So you lose your lean muscle mass, you lose your muscle, and the muscle that is lost affects the following. Muscle loss will affect metabolism, muscle loss will affect strength, muscle mass loss will affect your, let's just say, physique, or the strength, or the metabolism, or the long-term weight maintenance. That's something that arises if someone is using Ozempic and they are not actually exercising to keep muscle strength. Long-term weight maintenance will be a problem for such individuals. This is why lifestyle cannot be ignored. I'm still taking you back to the exercising and staying active. And in my section 4, I'll be talking about gallbladder problems. So the rapid weight loss increases another gallbladder issue, the gallstone risk. So for the symptoms of the gallstones, these are some of the things that someone is going to exhibit. Someone will get right upper abdominal pain, someone will get nausea. So those are some of the early symptoms of gallstones. The nausea, the pain after fatty meals, the right upper abdominal pain. Those are some of the things to watch out if you are on Ozempic. It's not, though, extremely common, but it is real. It can arise, so it's good to talk about it when we're talking about side effects of Ozempic. In my next section, which is section 5, I'm talking about pancreatitis risk. So pancreatitis risk is rare, but if it's there, it's very serious. So that's another very serious side effect of Ozempic. If it ever arises, it's actually severe abdominal pain radiating to the back, and it's severe upper abdominal pain in the same area. It may be on the right, but most of the times it's on the left. This requires immediate medical attention. Patients with prior pancreatitis need caution before they can be initiated on Ozempic. That's why at the beginning I talked about medical supervision before anything else. Then in my section 6, I'm talking about thyroid warning. That's another side effect. So animal studies showed increased risk of medullary thyroid cancer. So human evidence is very less clear about that, but since it's something that is listed in the side effects of Ozempic, it's important that I talk about it. But patients with the following, the MEN 2 syndrome, and patients with a personal or family history of medullary thyroid cancer should avoid the use of Ozempic totally. So those are some of the patients who should not actually attempt the use of this Ozempic. Given that they give a good medical history, then caution will be taken, and that is a measure that if it's taken, they stand to benefit more than just going into it blindly. This is not social media drama. This is labeling precaution. Those are some of the precautions labeled on the Ozempic drug. In my next section, section number 7, is we talk about psychological effects. And some of the psychological effects that these patients exhibit or experience. Some patients will report the following: reduced food pleasure. So you'll get that the dopamine centers for this patient will be deactivated, as we saw the impact on the brain, and the reduced food pleasure will set in. Sometimes there is what we call the emotional blunting. Sometimes there is what we call anxiety around eating. So food is social and food is cultural. So if it affects those habits that someone is already used to, then we find that there will be issues socially for that person. So the rapid appetite suppression can affect identity, and that is still psychological. And for when you're discussing about some of those psychosocial impacts of Ozempic, that is what we imply. That's what is happening. So that needs discussion, and that needs thorough support if someone is going to experience that kind of side effect. So I want to conclude by saying that Ozempic is effective, yes, but it's not side effect free. So as much as you're talking about its effectiveness in weight loss, then also we should not shy away from opening a discussion on its side effects. So the key difference between safe use, that's the only key difference between safe use and the dangerous use. So how can you avoid that? We avoid that by embracing medical supervision, and that is the key way of addressing the side effects and also the hype about this drug Ozempic. Medical supervision, it's there, it's in use, and therefore needs proper medical follow-up. What happens when you stop Ozempic? That's what I'll be talking about in my next episode. That's where many people are unprepared. So subscribe, let's continue this discussion. I'll see you in my next video. Thank you for watching.